Victoria, are you ready for us?
Yeah.
Are we ready for her?
Yes.
Let's do this.
Okay. My name is Victoria, and I previously told I am a doctor, and this is also my first presentation in English in this country. And I'm really obsessed with COVID virus, and this is the most important topic for me in the last year. And let's discuss what we know about the COVID vaccination. In 2019, the world was struck with new and unknown virus COVID-19. It was a worldwide disaster that affected people all around the world. The virus affected the economy and social life. The first measure to prevent COVID virus was shut down all social places and force people to lock down. Many scientists and doctors compare this disaster with another disaster in 20th century, the Spanish flu. According to the Cleveland Clinic medical professionals website, the Spanish flu pandemic in 1918 infected an estimated 33% of world's population. There were no effective treatment and no widespread effort to prevent the spread. What the common between these two viruses? They both infected respiratory tract. Both of them contaminated and world spread, and both high deadly among all ages. But what the difference between these two viruses? The Spanish flu, like in microbiology side, it's totally different two viruses, different family of viruses. For Spanish flu, no treatment such antibiotics or vaccine prevention during the time. And the Spanish flu was highly deadly among more young population as COVID and more old population, but still is both high deadly amount. No lung ventilation machine 1 century ago, and isolation and self-hygiene was only one treatment for Spanish flu. In 2020, the COVID vaccine from Pfizer Pharmaceutical Company was presented. It was the first vaccine that was approved by CDC. The vaccine was new and the side effect was unknown. The vaccine didn't have a long time observation period among the people, and it was mandatory vaccination all population to prevent the spread the viruses. The COVID vaccine, as just like every other vaccine, has side effects. But the common side effect is the pain, redness, and swelling. And another, it could be tiredness, headache, muscle pain, chills, fever, and nausea. But after a year of vaccination, the number of side effects and autoimmune disease start to increase. The side effects are as myocarditis, which is inflammation of heart valves, increase among the young population. Anaphylaxis, this is allergic reaction for the component of the vaccine. Thrombosis with thrombocytopenia syndrome, which is an ability to blood make clots, so you start bleeding in all vessels, what leads pulmonary hemorrhage. Also another one, Guillain-Barré syndrome, which is you shut down all your muscle system and person becomes paralyzed temporarily. And another one, and most of them important for me, extensive myositis with rhabdomyolysis. So when your all muscles start lysing and just destroying, you can able walk, you can able breathe, you can able, so all your entire body just shut down and you try to survive. Does CDC inform people properly that vaccine has this side effect? Like, ask you, all of you, how many of you read the writing concern when you take the vaccine? Somebody? Okay. Does CDC have all information on the main page of the website? Can you find how many side effects the vaccine has? We know about only one, like the vaccine is safe and proven and effective. But if you try to search it on the website, you have another link that says adverse effect and have a big pages with all side effects, but it's not in written concern. honestly, like, I did a vaccine, I didn't read what is that, because you have to, and you just take the vaccine, but unfortunately, it's a lot of complications and side effects, what could be in old people. And when you take a vaccine, the primary physician care should be able to advise pros and cons of vaccination in particular situation. And the claim that vaccine safe and effective should be also include, it also have a side effect. Please consult your doctor before you take it. Mandate of COVID vaccine. So when the vaccination becomes mandatory, people start thinking about the human rights. The online international medical journal, The Lancet, published the article Mandatory COVID Vaccination and Human Rights. The European Convention of Human Rights recognized this by considering the right to physical integrity under Article 8 to be qualified rights that can be limited for the protection of health. Article 10, if a mandatory vaccination scheme aims in part or whole to reduce harm to others, it is not paternalistic, which means relating to or characterized by the restriction of the freedom and responsibilities of subordinates or dependents in their supported interests. So in general, it's not harm to human rights. Primary care physician should be responsible for vaccination decision. Decision should be based on the age of the patient health condition, the contraindication, and occupation also. The position, the vaccination is mandatory, and period, it's not right for both sides. Does vaccine protect properly during the time, or efficacy of the vaccine will decline? With the COVID vaccine, immune response is declining, and scientists start to propose the booster vaccine. Originally, what we know about the vaccine, vaccine should protect you 100% against the virus. What we have, mumps, rubella during our childhood. So this vaccine protect you during the life. The COVID vaccine doesn't work this way. The Oxford University study, based on the more than 3 million nose and throat swabs taken across Britain, showed that 90 days after a second shot of Pfizer or AstraZeneca vaccine, their efficacy in preventing infection has slipped to 75% and 61% respectively. Scientists claim the vaccination does not stop the transmission of the virus, but it helps with severity of the cases. So the vaccine not work as should be. And in conclusion, the vaccine is a hope to prevent these illnesses and getting back to normal life. But vaccine is not perfect. It has not fully explained adverse effects and harm people's health. Mandatory vaccination makes people think about the human rights, a right to choose. Primary care physician opinion should be taken in consideration during the vaccination, and the immunity against COVID declines over the time, and vaccines do not prevent transmission. The COVID virus is still not fully understood, and the effects of the vaccine are not fully proven, which means the COVID vaccination is still a questionable topic. Thank you for your attention.
Thank you.